Hi, we're really glad you're here. I'm Pam McConaughey with the Greater Brighton Area Chamber of Commerce, and I'm joined by Katie. Go ahead.
Oh, hello everyone. Katie Chuba from the Heartland Area Chamber of Commerce, joined again on our webinar series, Getting Back to Business. And I'm just excited that we have some health experts with us today. And the collaboration that has been happening with the chambers and our other partners in Livingston County has been wonderful to bring a lot of valuable tools and resources to the area businesses. So thank you. So I'll turn it over to Janelle as our attendance keeps climbing. We can talk for a few minutes and I can kind of let you know when we have everybody signed on that's going to listen today. So go ahead, Janelle. Thank you.
Awesome. Thanks, Katie. Thanks, Pam. And thanks to our experts today for joining us. I'm Janelle Best with the Howell Area Chamber of Commerce, and we are so excited to be back here again this week, collaborating our multi-chamber events, bringing, uniting forces and being better together, stronger together as well. So thank you. We love the collaboration, and we hope you guys are enjoying the information that we're able to bring you. And we're very, very excited and honored to have our experts with us today. So I will pass it back to Pam.
Okay. I'm watching the numbers. They're climbing, so we're stalling just a little bit to get everybody on. We have a lot that are going to be attending today, so we're going to just take a little time. But Marcia Gaborowski with the Ann Arbor Spark, she doesn't appear to be with us right yet, but she's also one of the partners, and we're really pleased to be collaborating on the series, Getting Back to Business. So thanks for being with us. This is how we're going to do this. I'm going to do some introductions, and then we're going to have a presentation, and then we're going to follow that up with Q&A. So we ask that if you would please mute your phones, and then we'll unmute you towards the end. Okay? Sound good? Anyway, so today we are continuing on with our Getting Back to Business webinar, featuring information on safe practices, rules, and regulations when returning to work, in the status of Livingston County, and changes in the state's executive order in accordance with the CDC guidelines, which are always changing. So that is, I'm sure, challenging for our guests today. I'm pleased to introduce you to our guests today who will be presenting. And then, like I said, after their presentations, there will be time for Q&A. So if you would, in the Q&A portion of this Zoom, ask your questions there. Don't put them in chat, because we'll be going directly to the Q&A section. And so I'm going to begin with the introduction of Dr. Juan Marquez. He is our new medical director for Livingston County. He also has a larger job than that, because he is also the medical director for Washtenaw County. And at this time of this crisis time, I'm not quite sure how he keeps up with everything, but he is here, mask and all. And then joining him today is Dr. James Pierre, and he is a general preventative medicine and public health resident at the University of Michigan. He's working with patients with COVID-19, and so he's very entwined with all of that. So we are fortunate to have his expertise with us today. So with that, how are we doing? Are we ready to roll? Okay, Dr. Marquez, if you would take it.
Yeah, sure. Thanks for the introduction. And is it okay if I share my screen now? Is that
sure?
Okay, great. So so Dr. Pierre has helped put these slides together, and so there are quite a bit of slides. So I'll get started here. And so really the framework we're going to do is talk a little bit about so these are some of the disclaimers. So what we're talking about today will likely change in the near future. So these are the sites that I would highly recommend going to. There's CDC, OSHA, MDHHS, and then of course the Livingston County Health Department. So we're going to talk a little bit about the COVID-19 background and just give an update of what's going on. Talk a little bit about infection prevention and control plans. Talk about risk assessment, and then kind of focus on some of those hierarchy controls. All this might be a little bit nebulous, but hopefully by the end we'll clear it up a little bit. And then also kind of going on is hygiene and sanitation measures, what it means to maintain a healthy work environment, physical distancing, and employee considerations. So Dr. Pierre has a very good quote here they put together. Always remember, all you need is the plan, the roadmap, and the courage to press on to your destination. So, we're gonna, hopefully the goal is to really come up with a framework. So the goal is not for the audience to remember every single detail. That's why we include many of the resources. It's really to have a framework of how to approach reopening businesses and how to keep everybody safe. So in terms of some of the background, so what is coronavirus? So coronavirus is the name of the virus that causes COVID-19, right? And so the name of it's actually called SARS-CoV-2. It sounded too similar to SARS, so they changed it to basically have a different name. So COVID-19 is actually the infectious disease that's caused by this SARS-CoV-2. And it is we'll talk a little bit about sort of the symptoms, but it is a very varied illness. So here in Michigan, as of yesterday, we have 40,400 cases, almost 3,700 deaths. And then as of yesterday, we had 1,137 confirmed cases yesterday, and then 103 deaths yesterday. And you can see here, sort of in the southeast region has been hit a bit harder than the rest of the state. And so this is, I think, some things to kind of understand about COVID-19. So it is a very, very disease, meaning that you can have asymptomatic, so somebody that doesn't have any symptoms, you can have that sort of presentation, but you can also have life-threatening presentations where someone is in the ICU, is ventilated, and may even die. So it has a big spectrum of presentation. It's spread through a few ways. So the reason that sort of everybody wearing a mask is that there's a thought that it could be a droplet spread with potentially some degree of aerosolization, but mostly thought to be droplets at this point. Fomites, which basically means it's surfaces that you touch, so doorknobs, tables, things like that you can sort of linger on those surfaces. And then there's a thought that some percentage, so maybe 25%, maybe a little bit more, a little less, is thought to be through asymptomatic spread, so that people aren't showing symptoms, but it is kind of spreading before you have symptoms, or people may never have symptoms. So an incubation period means, how long is the period before you basically get exposed, get the disease, and then start showing symptoms. So we use a pretty wide range, which is 2 to 14 days, but on average, it ends up being about 4 to 5 days. And one of the notes here is that, so even though we're saying that you can start having symptoms and we kind of consider you infectious at that period, you can actually be infectious for a couple of days before. So it makes it for a very, very difficult virus to track, actually. And so currently, it's in Michigan, especially in Southeast Michigan, we have an elevated risk level. Currently, because of the stay-at-home order, we're using social mitigation to really control the transmission of disease. And even though anybody can be affected, the folks who are highest risk are those who are elderly and those who have comorbidities. So those are kind of the highest risk for disease. So these are some of the typical symptoms that we hear about. So fever, cough, shortness of breath. And some of the data review that we've done, this covers a big portion of people that are presenting with the disease, but it doesn't cover everybody. So we also see fatigue, headache, nausea, vomiting, myalgia, so muscle pain, sore throat, GI symptoms like diarrhea, nausea, vomiting occasionally, chills. A very specific symptom, which is loss of taste and loss of smell. We don't typically see those in other coronaviruses. And so and one thing that we didn't put here as well is that we started to see some skin rashes as well, and sort of some of these toes that have some discoloration as well. So what is the goal? So the goal is really, that's the background behind COVID, but the goal is to really keep everybody safe. And the way to do that is sort of threefold here. As we have, it's the plan, it's to prepare, and it's to respond. So the planning is really before you open, before you have any cases, any exposure, what are you going to do to prevent exposure? So preparation is then how do you implement what your plan is, and then the response. So even the best laid plans are not perfect. And so how do you respond to ill employees or their families? And really, how do we keep businesses going? So I want to turn to this framework. So this is the Governor Whitmer put together a framework, and I think that it won't apply. So it's a very broad framework about how to open businesses across the state. So it's not necessarily going to apply to, this framework won't apply necessarily to your own particular business, but I think it's a very good way to frame what's going on here. So here you have this idea of where we are with the risk. And so you have something that's urgent, stabilizing, or recovery. So right now, we kind of are in the middle between the urgent and stabilizing. And that's basically what is the risk of COVID-19 to the general population. But that's not all. So you also have workplace risk here, which is it low risk? Is it medium risk? Is it high risk? And so the governor and her team are using this framework to basically decide how to open businesses. So for example, here, the pandemic risk is urgent and, workplace in general is high. So, only critical industries could open. But, once the risk becomes, workplace risk is lower and the, pandemic has recovered, you can really lead to all segments to be open. And I think she does a very good job of explaining, as well as her team. Here we are in this Detroit region, and these are the MERC regions. There's 8 different regions, and so each of these regions will open up based on data, essentially. And so here we can see that for our region 1, which is this MERC region 1, it started stabilizing, but the cases have not yet gone down. All right, so that's kind of the big picture, but let's talk about a little bit about what you should consider in your plan. And I think that's what a lot of folks here are trying to figure out. So the part of the plan are really a fewfold. So one is risk assessment. And so what that means is really, how do you identify risk for not only your staff, but also your customers? And how that risk can potentially, so what are the sources of risk that are coming from? And we know that, it's essentially impossible to reduce all risk. So then how do we reduce transmission through implementation of effective controls? And then, as I said, it's even the best plans, even the best controls in place, you're still going to have situations where it's not enough, and there's potentially some either staff or customers who are exposed or are sick. So then how do we mitigate the staffing issues that are associated with that? So here's some of these ideas about risk assessment. And I should say that the MERC Council is they also have their framework for risk assessment, I think we'll talk about, but this is kind of some things that you should think about in terms of how to understand the risk that's posed. So who are the staff and what type of duties are they performing? So for example, if your staff is, younger folks who are, sort of in cubicles away from everybody, that is a very different staff model than maybe older staff or staff that's working front lines. So what is the business doing? What activities are involved in the business? So, again, is the business something that you're out in the community with, high risk of exposure, or is it something that's more office based? What are the cleaning protocols in place? So, if it's a very busy, high traffic business, what is the cleaning procedure they have in place, and how can you augment them? That's part of the control measures. What is the congregation potential? So are there, is it, separate offices where people work independently, or is it somewhere that, there's a big open floors plan where people can congregate, or maybe people have lunch together? Similar idea with, are there shared items? So does everybody have their own computer? Does everybody have their own business? Or is it a manufacturer where, there's a lot of shared items that are going between folks? So these are things to consider when you're thinking about the risk that's associated. So a couple other things here. So it's social distancing. So are you able to socially distance? So does the customer flow allow for this? Or are there areas that would not allow customers or staff to distance? And what are the potential risks associated with that? So for example, let's say that everybody comes in through one small entrance. Well, if there's a big flow of folks who are coming at the same time, that would not allow folks to socially distance. So that's just things to consider. We'll talk about the control measures, but that's just when you think about your risk. Languages. So I think that's really important that we spend, especially in public health, we spend a lot of time messaging, but if you have different languages, then you may have to consider how to message appropriately in different languages. So when you put all those things together, you can come up with basically a risk exposure, a pyramid of risk. So here you have very high risk. We'll talk about what that means: high risk, medium risk, and lower risk. So very high risk are really jobs that have high potential to exposure to known or suspected sources of COVID-19. So this is something like, for example, a ER doctor who is intubating a patient. That's causing a lot of aerosolization. So that we would consider very high risk. On the other hand, a high risk job is maybe a non-ER doctor, but somebody who sees patients on a regular basis that either you know that there's a COVID patient or there are folks who are potential for being COVID. Medium risk, I think, is what medium lower risk are the jobs that most people fall into, which is that, medium risk, you might require frequent and close contact with people that might not be effective, but you don't really know. So that's, for example, schools, restaurants, really anywhere where you're shopping, anywhere where you're around folks who the public, I guess. And then lower risk jobs are really maybe some office jobs or remote jobs where you can, work remotely and you don't really have that interaction with either co-employees or the public. And so again, we kind of talked about this. So, healthcare workers who are doing aerosolizing procedures. Here is, just other general healthcare workers, retail settings, high schools, education, and then this lower risk category as well. So I think I would say that if you take anything away from this slide, from this presentation or this talk, it's really, this is what I would really recommend, which is the hierarchy control. So these are, what we talked about was all the sources of exposure to risk, right? So these are, all the things, in terms of your staff, in terms of the type of business you're in. But once you know that exposure risk, you need to know what to do about it. And so I think this is the most important slide you can do. And so here is sort of, and it's like a reverse pyramid or triangle. It goes from most effective to least effective. So the most effective thing is elimination, right? So working from home completely eliminates that risk. But it's not feasible in many cases. So if it's not feasible, then the next control is engineering control. So these are barriers or sort of functions that you can basically put into place that don't involve staff to do anything. So this would be physical barriers. So you think of these plexiglasses at the checkout station, ventilation. So things that will mitigate the risk but won't require anybody to change their behavior per se. When you look at then administrative controls, so are things that again are done on a sort of population basis but are more require behavioral changes. So for example, working from home is an administrative control, even though the physically being at home limits the risk. Changing that schedule or changing to a teleconferencing system is really an administrative control. Staggering schedule. So instead of everybody coming in at 8, somebody comes in at 8, 8:15, 8:30, etc. Hand hygiene. So making sure that there's appropriate washing stations or hand hygiene stations throughout the building. And I think this is important. So this here, as we can see, is the least effective method of protecting folks, but it is, I think, one that we have heard the most about, and one that is really important for people to consideration. That's, are you going to have masks, for example? Again, this one, respirators, gloves. So I think that this one, rightly so in many cases, because we can't sometimes socially distance, we can't implement effectively other strategies. So this one ends up being, I think, the default thing that people focus on. But again, when you're considering your plan, you should really consider this entire range. So elimination, engineering controls, administrative controls, and then in the context of that, really think about PPE. And these are just some examples of the hierarchy of controls, ventilation, having plexiglass around here, hand washing, working from home. So this is, I think, the OSHA, that's the way that OSHA has framed this. This also has been framed in the governor's plan. It's just, kind of a little bit different, framed a little bit differently. So basically the way the governor's plan has worked is that there's basically 5 buckets of risk mitigation. So it's called access control, so making sure people who are coming in are not symptomatic or not exposing others. Socially distancing, so making sure that, when possible, you avoid close exposure. Sanitation, hygiene, PPE. And then this part, which we didn't really talk about, is contact tracing and isolation. And what that really means is that, again, even the best laid plans, you can't guarantee. So if somebody, an employee or a staff or a customer comes in and is found to have COVID positive, is found to be COVID positive, then, there's a protocol to make sure you understand who that staff or customer interacted with, and make sure that they are either appropriately quarantined, or they become symptomatic, appropriately isolated. So it is really a facet of that you should consider in your plan as well. And if there's questions about that, we can talk about that. We at Public Health, we do this quite a bit. So again, mask and social distancing is really important. I think everybody understands it. But hand hygiene, again, this is transmitted via fomites. So via surfaces, you touch the surface, you touch your head, your face. So as much as possible, you have to be able to wash your hands. And if that's not possible, then you may have to make sure that there's alcohol-based sanitizer, at least 60% that can be used. And so both strategies are reasonable. So if, for example, people are coming back from break, they can wash their hands if there's bathrooms. But if that proves to be a challenge, then, again, as part of this administrative control, you should be able to make sure that there's a number of hand hygiene stations throughout the facility, so that folks are, anytime you get near a door, anytime you come through a door, you're sanitizing your hand. Anytime that you potentially might touch anything, sanitizing your hand. So making this just ubiquitous and making it the culture so that everybody understands that they should be, having good hand hygiene. And I don't think put this as well, but everybody has masks. I think everybody will be wearing masks, but the other thing is respiratory hygiene. So, I think that many times when we sneeze, we're used to using our hands. It's really having the better, sort of changing culture, so that when you sneeze, you don't sneeze in your hands, you sneeze into your crook of your elbow. So things like that, where it might seem like small things, are really quite important to avoiding transmission. So other general things. So social distancing. So why does social distancing work? So social distancing is a really important aspect because, as we kind of mentioned, it's the thought is that it's transmitted mostly through droplets. Droplets cannot cannot go that far, especially when you have a mask. And so when you are, if you are, anywhere from about 6 feet away, the thought is that you really are at low risk for having a droplet make it all the way from somebody who's sick to you. And so that's the idea behind social distancing. Staggering work shifts. So again, and this can be done in various ways. So sometimes I think they're staggered completely, so that it's 2 weeks on, 2 weeks off, or it can be staggered in a given day. So instead of having everybody come in at the same time, you really try to stagger it so that not a big bolus of people's coming in. Working from home, I think that it's just something. I know we've all been trying to work from home as much as possible, but it's just something to continue. That just because some of the stay-at-home orders have been lifted, it does not mean that working from home is a bad strategy. So we kind of think about that, that framework, these high-level elimination strategies are the best. So as much as you can, work from home. Frequently wipe high-touch surfaces. So again, it's cleaning your hands with gel is super important, but also, having staff actually go through and frequently wipe high-touch surfaces. So this is things like doorknobs, light switches, counters, telephones, keyboards, anything that's touched frequently. Universal masking. So I know that, and this might be a question, but that comes up, but I think that everybody from now on will be universally masking. And the reason that that's helpful is that it's not actually to protect the person who's wearing the mask, it's to protect others around them. These cloth, especially the cloth masks, but also the surgical masks, I should back up. So these cloth masks are fine for preventing sort of sneezing from going away, but they don't necessarily stop sneezes, sort of droplets from coming in if you're too close. So the idea is that if everybody's wearing a mask, the ability for a virus to go from me wearing a mask to somebody else wearing a mask is quite low. So that's the idea behind universal masking. If somebody is in a critical infrastructure worker and is coming in before a 14-day quarantine period after an exposure, that person should absolutely mask whenever they're at work. And the reason for that is that the exposure puts them at higher risk. It puts everybody at higher risk. So, for example, myself right in here, I'm in my office, there's nobody around me, I take my mask off. If somebody has a high risk exposure, part of the company policy might be that they keep their mask on at all times. So that's just something to think about. And some of the employee consideration. So if somebody's symptomatic, go home. And I don't just mean fever, cough, shortness of breath. I mean, if somebody has diarrhea, go home. If somebody starts having muscle pains, go home. If they start losing their smell, go home. So really, it's a very broad set of symptoms that we consider to be symptomatic. Okay. So if somebody is COVID positive, then we can talk about sort of what the public health role is, but in general, somebody who's COVID positive, they should inform their employer, and then the employer should inform employees of exposure. Now, we don't encourage, we typically don't disclose the name of the employee. We just give a general sense that this was an exposure. And so, sometimes it's impossible to not identify that person if there were specific shifts, but, we don't really disclose who was positive. We just say that this particular area of employees was exposed. And in terms of exposure, what that really means, and this is a little bit more details, but it would be, somebody who, for example, if I'm walking down a hallway, big hallway, and I pass somebody who's COVID positive, that's not exposure. And exposure would be if you spend more than, several minutes. We use 10 minutes as a cutoff, but 10 minutes, within 6 feet. Of course, there's variations, and this is some of the things that public health helps a lot, which is, well, was the person coughing quite a bit? Because in that case, maybe it's not 10 minutes, maybe it's a couple minutes. Was it an enclosed space? Then in that case, again, we might consider that it might not meet a 10-minute criteria. Maybe you don't have to be 6 feet. You're maybe 10 feet, but in an enclosed space. So these are all things that kind of can be a positive exposure. And then this is very important, which is this flexible, non-punitive, flexible sick leave and supportive policies. So the last thing you want is somebody who's positive to have to come to work and expose everybody. And so having non-punitive, flexible sick leave for them and for their family, right? If they have a child who's sick who has to be at home, you also would want them to sort of be able to take care of that child and come back when appropriate. So screening is really important. So what we typically recommend is temperature screening and a questionnaire prior to work shift. And we can kind of talk about some of the symptoms, but in general, the temperature screening should be done by either subjective is reasonable, but if a thermometer is not available, if a thermometer, like a thermal thermometer, like a forehead one is available, that is the preference. I would not have people share like an oral thermometer. So I would recommend a subjective fever rather than have everybody share a thermometer. If you do have, sort of a thermometer that many people are using, make sure, like everything else, a high touch surface, you wipe it down and you make sure that people have hand sanitizer right next to it. And then a symptom questionnaire, again, I would be fairly broad with the symptoms that are being asked. So absolutely fever, shortness of breath, cough, but also, again, these others, GI symptoms, muscle aches, loss of smell and taste, things like that. So a pretty broad screening. And this is a lot of information, but a lot of the CDC, MDHHS links will have links that will help create templates for this. And then again, monitor themselves at work. So if somebody is at home, at work and feeling sick, they should go home, right? They shouldn't wait for the next day. They should go home right away and call their primary care doctor. And again, this is sort of the additional guidance, and if we can send out this link, but it's basically guidance for businesses, preparing your business for CDC, preparing your small business, employees for the effects of COVID-19, FAQs, how to disinfect your facility. So really good resources that we kind of glossed over. All right, and I think that's all I got. So I'm happy to answer any questions that come up and anything. So thanks.
Hi, Dr. Pierre.
Yes.
Okay. Do you have anything that you would like to add before we go to the Q&A?
No, that was just a broad overview. But like Dr. Marcus was saying, there's more specific guidance that is available on the CDC's website. And though the guidance is changing, I would encourage everyone to visit that particular website to find the most updated information. And make sure that employees wash their hands, hand hygiene, and make sure that they actually wash their hands properly. Because there's videos and such that people should actually be washing their hands a certain way to make sure that all of the germs are removed from their hands.
Okay, so we do have some questions for you. I'll start with one that was sent in earlier. Will there be access to antibody testing? This may be critical for industries like dentistry, orthodontics, and healthcare professionals. And will these small businesses like dentists have appropriate access to PPE and FDA approved testing?
Yep, so that's a great question. So, so serology has been, I think, a very talked about test. And to back, I guess, so there's basically 3 types of tests that can be done, right? So there is it's a PCR test that is basically what I think most people might have heard about. You basically have a swab, you stick it in your nose, you maybe stick a mid-nose, and you basically put in a tube and it gets sent off and gets processed. So this is a PCR test that's looking at little bits of DNA, right? And that's what we consider the gold standard now, really. And it's what we would use to make a diagnosis. I'll talk about serology in a little bit. I'll jump to the third part, which is a direct antigen test. So a direct antigen test can be seen in things like Legionella. And instead of looking like little DNA pieces, you actually look for the antigen. So, you know, that sort of that ball and spike type picture everybody's seen, you're looking for those little spikes. Now, the reason I talk about that, and that is not available, that will be in the future, is that typically is a much more rapid test and it's more widely available. And so that's typically when we think of these sort of point of care tests that are done like immediately. Legionella actually has one of those. That's sort of what the goal is, but it's a very challenging test to make. Now let's talk about serology. So serology right now is I think it's been deemed appropriately the wild, wild west, right? So there are, I think, the last time I saw was more than 70 tests that are available for serology testing. None of these tests, short of 4, were actually approved by the FDA. And even the 4 were not approved for diagnostic purposes, right? So they have to submit their testing performance and then can start testing folks. Now, because we don't really understand the testing validity, there's multiple questions that are right now. So the first problem is that many of these tests, we actually don't know how well they perform. You know, tests from bigger companies like Abbott, I think, you know, have pretty reasonably good performance, but even the performance in a low prevalence area is going to be not great. So there are going to be a lot of false positives, even with the best test, okay? The second problem is that we don't know, so even if a test is valid in terms of their measurements, we don't know what lies in immunity currently. What I mean by that is that we assume that if you're exposed to COVID-19 and you get sick, you have a response, you have some immunity. We don't know that. There's no way for us to know that. And so there will have to be additional laboratory tests and epidemiological tests to understand that. So, so even if we have the sort of validated test and that shows that you have been exposed, we don't know what that means in terms of immunity. And then even if we find that the immunity it's true that somebody has immunity, we don't know how long it lasts, right? And so we don't know if it lasts weeks, we don't know if it lasts months, we don't know if it's forever, right? So I think those are the open questions. So the goal really is for a serology test to be available that will answer those questions. And I think there's a lot of research into that. But currently, those questions are open questions, and I would not recommend serology for diagnostic purposes. The purposes of serology tests right now are really twofold. One is research to answer those questions. 2 is to do surveillance on a population health level. So even though one test might not be valid or sort of accurately diagnosed, if we administer that to everybody in an area, we can look at trends in areas, and we can see that this area, even though each individual test may not be correct, because we're seeing a lot of signal in this area, we think that there might be some truth to that, where this area might be more effective. But again, that's on a population level. It's not so much on an individual level. And so I think that, yes, I think that we're all very anxious looking for this test, but it's just not there yet. And I would not recommend people taking it to prove their immunity and going back to work. And what I mean by that is that you have 2 situations, and they're both not great. The first situation is that you think you take the test and it tells you you're positive, and it's a false positive, right? So I think that a false positive would give everybody the impression that, hey, I've been exposed, I'm already immune, I'm good to go. Well, we don't know that yet. And so what can happen is that, maybe you don't wear your mask, maybe you don't do social distancing, because you're very confident of the results, and you end up getting sick, right? So I think that is sort of the most dangerous part. The false negative is also, I think there's less of that, but there's still this idea that a test can say that you haven't been exposed, and so but you really have. I think that the consequence of that are, basically more conservative. But my concern is really that false positive. And then in terms of PPE, so I know that so I would contact actually you can contact Livingston or United County for helping with some surplus of PPE. So a lot of this goes through the sort of regional coalitions of healthcare, and there is limited amount of PPE that can be given out. So masks, gloves, gowns are going to be a challenge, and I've spoken with actually quite a number of manufacturers, and they're going to be a challenge for a while. And so, but masks are becoming more readily available. Gloves are more readily available. And then sort of eye protection also should be more readily available. So just if you reach out to here at the health department, I can give you my email and I can forward it to the right person.
Okay, thank you so much. Well, we hear, if you've already been exposed to it, and if you feel like you have that immunity, we have felt safer, but that's not the case, is it?
Exactly.
Nobody really knows. And then also that virus can mutate. And even if we get that vaccine, that might not even affect in a positive way to kill that virus, right? If it mutates.
Yep. Luckily, we haven't seen much mutation. So I think there's 3 strains currently we've seen in the US, and it's all been pretty stable. So luckily that part is a positive.
Okay. That was my question. Okay. Now hold on. Can you provide these slides to us?
Yep. I think so. Yep.
Okay, here's another one. If you are contagious for 48 hours before you show symptoms, why take a temp every day? If someone is infected, they have already exposed everyone they were with for the past 2 days.
Yep. So that's a really good question, right? So I would answer that 2 ways. One is that it limits the amount of exposure, right? So even though you might be infectious for 2 days, you're still, because you're checking it every day, you're not going 4 days, right? So less is better. So the less time you can expose folks, the better it is. The second answer is that we're learning more, but the thought is that even though you are infectious, it's not the driving force. It really is somebody who's symptomatic that's driving, especially in a generally otherwise healthy population. It's those symptomatic folks that are really driving transmission of the disease. So, there is some percentage that is through asymptomatic. We don't know what it is. There's a thought that, you have, 25%, et cetera, but the majority of it, we still believe, is driven by symptomatic spread. So you have a fever, it's the first sign something might be wrong, and then you can kind of limit transmission right there. For example, if you don't have a fever, but you stop losing your taste of smell or taste, then that you should stop right there. That's sort of the symptom. We've seen that as the first symptom in several people, actually. So as any symptom, you basically just stop at that point. Dr. Pierre, anything to add there?
No.
So can I ask you, when you lose your sense of smell and taste, is it completely or just slightly? What would you look for that?
I think any alteration, I think, is what we've heard, but we've, the sort of anecdotally we've heard, it's just like it's just like gone from one day to the next. And I guess these are sort of anecdotally, is that, we've seen it comes back, right? And so some of the folks who have been tested, the tests are positive until that comes back and then they're negative, right? So it's, again, this is like very few cases, 1 or 2 patients, but it's very, it's powerful anecdotes.
Okay. Somebody asked, how should people handle money? I think about that when I go to the store. I'm sure we all do. We take that money, we get our money back, and then we put it in our wallet. How should people actually handle money? And you might as well throw in credit cards too.
Yep. So Dr. Pierre, do you want to sort of give a go here?
Sure. I'll take that one. I would make sure that, and just keep in mind, like was mentioned in the presentation, the importance of hand hygiene. If you're going to touch an item that you think is dirty, even if it's something like, okay, you're going to the gas station and handling a gas pump, if you're handling money, if you're swiping your card, make sure that if you can't immediately wash your hands with soap and water, that you carry around hand sanitizer with you. So when you do, arrive home, or, you're about to start eating, so on and so forth, that you're able to clean your hands. Or if you're about to, touch money and then all of a sudden you need to, your eye is itching, make sure that you take the hand sanitizer and clean your hands. So I know it's been said, over and over and over and over again, but I really wanted to harp on and drill down the point that hand hygiene is very, 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 very important. And though, people will say, okay, I'm washing my hands for 20 seconds, that's what the recommendation is. There is, data that shows that a lot of time people, even after washing their hands, they still have, dirty hands. So I want to make sure that, people are doing a hand hygiene, but doing it properly, to making sure that their hands are as clean as possible.
Yep. And I think the other thing I would add there is, if you remember a triangle, right? The triangle of elimination, right? So this is a good example of how to even think about that, right? So what's the most effective way? Elimination, right? So eliminating touching that money. So how do you put things in effect to eliminate that? Can you do touchless? Can you do your phone to that? Can you do it online? Can you do it before? So that's elimination, right? So then we look at the next level, which is administrative controls, right? So let's say you have to handle money. And this, I think, is what, Dr. Pierre is talking about. What is the administrative control that you have to, sort of wash your hands, sorry, actually before that, sort of engineering controls, right? So is there a way that, let's say that you handle money or handle credit cards, that you can make it less? So maybe, there's a way to, instead of, this is a bit exaggerated, but, instead of, if you have a plexiglass, instead of like using your hands, but, having gloves right in there, right? So that's your engineering control. Administrative is what Dr. Pierre is talking about, which is, every time you touch, you wash your hands. That's a policy, right? And then the least effective one would be gloves, right? You put a glove on, and that's the least effective. But what happens with that glove? Well, you might not take it off right. You might touch your face, right? So like, this is when we talk about this, like, sort of these control mechanisms, you can apply it to anything.
Okay, it's all very interesting. Let's see. How important is it for employers to measure temperatures? Can it be done by someone without getting within 6 feet of the person being measured?
I think it's important. I think that if, again, like I would say that it is one of various symptoms. And so I think that if you can acquire a forehead thermometer and have the person do it themselves, that's fine. If you can acquire an infrared thermometer, that's fine. But if you don't have a thermometer, subjective fever is reasonable as well. And again, I wouldn't make it more infectious. So I wouldn't, if you had, all you have is like a oral thermometer, I would not use that at all. I would just take subjective fevers.
Okay, thank you. This woman wrote, I work in a public library, and one of the questions we are grappling with is the amount of time to quarantine materials that are returned to us. That's a good question.
Yeah. So I will give you two answers to that, okay? So I think that the CDC answer about sort of cleaning, shipping, I would use the sort of shipping materials as I think the CDC has talked about packages really, and I think groceries to some degree, but packages, I think there is no recommendation to necessarily not, what's the term I use it for? So if you come in, if a package, you don't have to clean it, you don't have to do anything to it, right? In transport. The more conservative answer is that if you know it was 48 hours since it got dropped off, or you can have a control to have it be there for 48 hours, that's probably the best. But but as Dr. Pierre said, if you touch it, you wash your hands, right? So again, we go back to this idea of these sort of measure, hierarchy of controls. So what's the number one thing we can do? Is there something to eliminate that risk? In this case, maybe not, right? Is there a engineering control? It's kind of hard to. What about the administrative control? What if you said for every book you let it sit for 48 hours, right? That's probably a reasonable way to do it. Another way to do it is that you could wear gloves for those things using PPE. So understanding these like controls is I think is a good framework for understanding things. But in general, we think that things that are dropped off, pose low risk, but there is it is not a zero risk. So to be very conservative, I think the recommendation is about 48 hours.
Okay, thank you. So this person wrote, just confirming the symptom checker diary is not required, only suggested, correct?
So the diary, so somebody keeping a diary every day is a suggestion. The screening process, I think I'm just trying to pull through the executive orders. I think for food services, initial screening is a requirement.
Okay. Do we have testing locations in Livingston County? And if we do, can you say where they are?
Yeah, so the testing locations, so St. Joe's has one location. I can send out an email with the address later. I don't know it off the top of my head. And then I think there's an urgent care, which is Michigan Urgent Care, also has testing. But the one I would probably recommend, just because of convenience, is the St. Joe's drive-through. If you give me I can look it up. I don't know the address off the top of my head.
Okay. Well, we could get it to the people.
Okay.
Here's another question. Our industry actually goes into people's homes to perform our work. Do you have any additional recommendations for our employees to keep them and our customers safe?
Yeah, so that's a really good question. I think, again, we go back to this idea of what we would look at that risk, right? So the risk is, if we think about the risk, there's exposure to the staff, right? But there's also exposure to the employee, right? So what can we do to manage that risk? So how do we eliminate the risk? So one, is there any way to not go to that person's house? Maybe not, right? It sounds like that's not the case. So, but then how do we mitigate that risk? Well, one of the ways, again, we know that there's some asymptomatic spread, but there's a lot of symptoms that are associated with this. So, on your phone call, when you have an intake, can you say, hey, are you having any fevers, coughs, chills, diarrhea, anybody in your house having that, right? And if the answer is yes, well, you can decide not to go there, or you can decide that you'll take additional precautions, right? So you can kind of eliminate that risk to some degree. And then, if you do go there, is it, are you able to have some sort of engineering controls? So, for example, if you can imagine something even, if you are, I don't know, repairing something, are you able to put plexiglass around you so that if they do have people crossing by, they don't get near you? Of course, that seems a little bit, but if you can imagine it's like a busy, high volume area, that might be an administrative control. Engineering control. Administrative control, so are you going to have, 2 people go, right? Because if 2 people go, that's going to get 2 people sick. Can you do it with 1 person? Can you do some things remotely and have only 1 person go? If somebody goes and it's a high risk area, are you able to have them go then quarantine for a period of time, right? So these are also things to think about. And then of course, when they actually go, having gloves are reasonable, masks are reasonable, and then asking the person if they're not having any symptoms to wear, you can bring along a mask and gloves for them and have them wear it as well. So I think that will keep everybody safe. But again, we go back to this framework of how to think about things.
Okay, thank you so much on that. Is wearing a mask necessary in an office if you are remaining 6 feet from others?
It's a complicated question, to be honest with you. I would recommend it, and the reason it's complicated, and I don't want to get into the sort of the weeds, but we believe that the majority of the transmission is droplet, meaning that it's these big sort of things that could but some of the studies that are coming out show that it may be some degree of aerosolization. And so we still use the 6 feet because I think it's a good practice, and that's going to, sort of remove the majority of the risk, the vast majority. But, if I am, 8 feet away from somebody, does that mean that my risk is 0? No, of course not. So I would use a mask to keep, everybody else safe around me.
So if you're taking a hike and you're going down a path and you pass people and you're 6 feet apart, but the wind is blowing and you feel that wind blowing, is that a dangerous situation if you don't have a mask on? I'm asking, this is my personal question.
So I would say that there have been studies that looked at this, actually, sort of the dispersion of, droplets around somebody. And, I would say that if they're passing you quickly, that exposure time is quite low, right? And
Okay.
so I would say that it's not ideal, but it's not something that I would consider a true exposure. That being said, if you're behind this person the whole time and they're just spraying you, that is an exposure that I would consider. But, just a quick passing.
So there's not a lot of risk if somebody rides the bike past you.
I think it's low risk, I'd say, very low risk.
Low risk. All righty, good to know. All righty, we're moving forward. Your thought on the Detect smartwatch study. Do you know about that?
Oh, is that the one I think it's the one that's looking at like heart rate variation. I have no comment. I haven't looked at it enough. Yeah.
Okay, Dr. Pierre, have you ever heard of that?
No, that one is a new one on the radar. I'm after
That must be a new one by Apple or something. Now they're honing into the COVID-19 on the Apple watches. Just kidding. Just maybe not kidding. Okay, here's another question. Is normal soap and water acceptable, or should we be using antibacterial soap?
Dr. Pierre, any thoughts on that?
From what I've read, normal soap and water is just fine and suitable. As long as you're making sure that you're doing the hand washing, using the proper steps, and washing for the proper duration of time.
Okay, and then I think you answered this before, and it all goes back to washing your hands, but what about handling mail and packages? I think you covered that already.
Yeah, I think I think the CDC does not recommend any additional steps, but of course I would recommend washing your hands and or using hand sanitizer.
Okay, here's a resort industry question. Are swimming pools, lakes, showers, and saunas an issue for transferability, and what precautions can you recommend?
So it was late. Which was the pools? What else? Saunas?
She said, let's see. Here's a resort question. Are swimming pools, lakes, showers, and saunas an issue for transferability?
That's a really good question. I think pools are not because they're chlorinated, right? So I talked about the physical thing. So a pool is chlorinated. I don't think that's a risk. Saunas, I believe, are chlorinated as well, so it shouldn't be a risk. So showers in and of themselves are not risky, but you can imagine, what do you do with a shower? You turn things, right? So most things you turn a dial, you're potentially near other folks. So even though the actual material I don't think is very risky, a sauna, you're near other people. You go into a locker room, right? Before and after. So, when you're in the locker room, are you near people? Are you touching the locker? Are you, able to socially distance? So the pool itself may not be dangerous, but if you think about sort of what we talked about, you have to think of sort of the entire process. How is somebody going to get into that pool? That pool, they might not get sick from that pool. They might get sick from being in the locker room with somebody who is positive. So sort of thinking through that process of how to socially distance in a locker, how to make sure that, people are cleaning, using high touch, cleaning high touch surfaces, kind of thinking through that process.
Okay, sounds good. The public comes into our office to pick items up. She's wondering if you have signage templates that they could use.
So I don't, but I should, and we can put this in the slides and maybe send this out. So Lear has a playbook actually for going back to work, and they actually have very good signage in that playbook. So we can send that out. Yeah.
Okay, that sounds good. Yeah, I've heard about that playbook and people are really talking about it. Some are saying the antibiotic test is good to get just to verify you have, if you tested negative, okay, verify you have it if you tested negative, but definitely seem to have it. I'm sorry, this one's a little hard. A possible false negative on the first COVID-19 test. Not sure how to make.
Yeah, I would say the recommendation would not to get a serology test at this time unless it's part of a larger study. I think that if there are real diagnostic concerns, then a PCR is really and you can get false negative PCRs. We've seen it before, but I would still use it as the gold standard.
Okay, if you have an employee with 1 or 2 symptoms, how long do they need to be off work? And if the symptoms are no longer present, and should they have a doctor's slip to return to work?
Dr. Pierre, can you answer this one?
So if you have someone and they're off from work, the recommendations would be if to not have fever for 72 hours, and that's without any kind of fever reducing medication, and also to have at least 7 days since the onset of symptoms. So 72 hours without fever and symptoms getting better, and at least 7 days since onset of symptoms.
Okay.
Whichever time period is longer.
This is a little bit similar to another question that was asked, and let's see if it's any different. What is your thought process on dentists who deal with significant aerosols, along with dentists' inability to order PCR tests or swab in their offices? The lack of PPE procurement makes it nearly impossible for some dentists. Any thoughts on this?
Yeah, I mean, I think the big struggle is PPE. As I mentioned, I think the N95 situation. So I would say in that situation, I would probably recommend N95 mask, to be honest, and appropriate eye protection, and a gown for everybody, because we don't know, again, we don't know the folks who are in the patients, but it is a challenge. There's no good answers to that.
Okay, we remarkably answered all of the questions, and it's just about time to close. So well done. You had all those answers for those questions. Thank you so much. Thank you so much for participating in this today. I don't think that we can have enough of these informational sessions on this. Ladies, do you want to add anything?
I don't have anything to add. Thank you so much for your time today. We really appreciate the information.
Yeah, I was just gonna, same thing. I just wanted to say thank you so much for your time. We truly appreciate it.
We know this is the height of everything for you, so thank you for helping to keep us safe here. Then I'm just going to talk about our May 5th, Getting Back to Business webinar. It's going to be fire and safety is going to be discussed. And we have Livingston County Area Fire Department Chiefs Adam Carroll, Andy Pless, and Mike O'Brien, and Livingston County Sheriff Michael Murphy, and they're going to talk about best practices in maintaining a safe atmosphere for staff and the public when establishing your open for business plan. So we are excited about that one. So that's coming up. I believe that is Tuesday, May 5th. I think May 5th is the Tuesday. And so we hope to see you all then. We want to thank you so much for participating in this today. For our participants, and also this is being recorded. Somebody did ask that, and I do think that we answered all the questions. If not, shoot them to us. We'll shoot them out, and then we'll shoot them back to you, okay? So until then, stay well.